So today I have I'm sharing with you briefly that there are definitely other trainings out in our community in terms of the topic of family. Just first of all, I don't have any financial relationship to the content of this presentation or for giving this presentation. And the slides were prepared by Dr. Lindsay. And so today the topic is concerned significant others and family intervention, which is an essential topic when we're talking about increasing our odds both ways, right? Or our odds of treating somebody and for that person to meet their goals in terms of substance use recovery. Hopefully, at the end of today's presentation, you'll be able to identify the core concepts of family intervention and best care standards for providing family and strategic intervention, discuss the importance of working with families and concerned significant others, and we'll talk about what that means for substance use population, and identify the effective methods for incorporating family and concerned significant others into standard practice across populations, and of course, the importance of the context systems and feedback exchanges in all of our clinical interactions. So in order for us to be able to think of how do we include and what do we mean by family, we should share somewhat of an operational definition, a common one that we all understand. I think very often when we're looking at treatment, we think of biological family, but very often in the world of substance use, we have to be really attentive as to who are the people for the patient who are the most important to them, the closest ones. I think I often, in working with patients, I like to borrow the model from the LGBT community, a community, gender and sexual orientation minority that very often gets rejected by their own biological families. And so one of the things that people in the community, in the LGBT community do is start to form their own families, right? So they'll have mothers, brothers, sisters, children that are not biologically related to them, but they are seen as that. And they're very important in their health and their well-being in general. So I think it's an excellent model for us to think, because in substance use, again, due to stigma, sometimes due to the situations, there are many family members that are not longer part of somebody's treatment or even somebody's life who has a substance use disorder. And so, or who's struggling with a substance use disorder. So what do we mean by family again? That would be whomever it is, whomever are the people who are the closest to that individual. So when we are thinking of treatment, being able to leave room for us to define that with our patients and to be able to understand to what extent did they want them involved, right? So that's also very important. Sometimes there are family members who would really like to be involved in everything, and that's not necessarily what the patient wants. And so we respect their autonomy, patient's autonomy, in trying to understand to what extent should they be involved. And then also who should be involved. Notice that at the bottom, not only do we have biological relatives, we also have in-laws, we have friends, we have colleagues, and that's the reason why we use the term concerned significant other. That's a term that was developed by Robert Myers when he developed community reinforcement and family therapy. That's just one approach among several when you want to include families into treatment. And the reason why he did that is, again, the understanding that there are other individuals who can be very influential in the care of our patients. And then seeing this idea of seeing addiction as a family disease, right? I think very often in the US, if we think of the majority culture, it's very individualistic, and it's easy for us to forget that when it comes to addiction, everybody is involved, right? So I think some of us are here because we have had family members who have struggled with addiction, and we know that it feels sometimes easier when we're giving advice talking to our patients than when we're trying to deal with our family members, right? I've had, in working with adolescents, very often parents, I joke with them and say, I know you really wish that they would change their behavior and not harm themselves, and you not see it, to the point that I'm sure you feel like you wish you could lock them up in a room until they became an adult and you wouldn't have to worry. But life isn't like that, right? So they have autonomy. And at the end of the day, if we can teach them skills, if we can work with them together with physicians, peers, case workers, then they get to choose for themselves. So it's very important to know, because then what that means, why do families feel that way to the point that they want to lock up their loved one? Because they're so distressed. They feel so out of control in terms of watching somebody coming home all beat up because perhaps they were at the wrong place while they were using substances, alcohol, and they got into a fight, or somebody beat them up, or you see somebody coming in just pretty high and not themselves, right? So very distressing situations for the family, which in turn, we all have coping mechanisms and strategies in our families, but in turn, very often this turn to be unhealthy, right? So being able for us to see this as a family thing is essential, right? And how does that play, right? Who is more vulnerable in those situations, and how can we influence the family to be able to know how to help? Even if we influence one family member, even if we work with one family member, I probably shouldn't use the word influence. It almost sounds like we're going to like put ideas and they don't have a choice. It's more having them participate in different aspects. The more that they can learn how to positively help their loved one, the better the chances for the loved one to not only achieve their goals, but also sustain them in the long term, right? And then in turn, it also helps the family to be able to thrive, right? So notice again, talking about the stress, it definitely has that family atmosphere, right? So very often family members talk about walking on eggshells, trying to accommodate certain aspects so that if there's a loss of control, that things can go on. But again, some of those things, the very things that the family members might be doing in trying to help their loved one are the very things that are ensuring that the substance use disorder continues, right? And so what happens very often, then family members start to feel very overwhelmed, very hopeless, and start to develop a lot of resentment and hostility that eventually it becomes a vicious cycle, right? The more resentment, the more hostility, the more unhealthy coping mechanisms, the more unhealthy coping mechanisms, the more the patient is actually using. I think in another presentation, we were talking about function analysis. Very often in that function analysis, in the analysis of why is a person drinking, why is a person using opiates, etc., family members are always very surprised what are some aspects that are influencing their loved one to use, including some family dynamics, right? Some of the things that are happening. Anxiety, worry, fear are often reported as primary emotions for family members, along with depression, grief, guilt, shame, embarrassment, helplessness, and hopelessness. And for example, in our START unit with the adolescents, very often we hear families talk about how all of their attention is focused on the one kiddo who's struggling with the substance use disorder, while all the other kids are not. And then now they're getting into trouble in a different way because they're trying to figure out how do they focus their efforts, because they're just so afraid. They're really afraid that this one kiddo, it's at such a high risk of losing their life, right? So you can see, right? I'm sure you see how this family dynamics play out. What's very important, as I mentioned, is just identifying who might be most vulnerable within those family groups. Of course, children are the most vulnerable. And like I mentioned, when you have families dealing with addiction with adolescents, not only it's the child who has the substance use disorder, but it's also the other children within the family. And so if you look at over 70% of abuse and neglect cases involve substance use. So this is if the parents or caregivers are going through substance use disorders, and that unfortunately interrupts the development of that child. So what's really interesting, if you look at the ACEs, the more adverse experiences that child has because of the substance use that is present, the higher the chances that they're going to be very key components of that child's development that are going to be either stopped, delayed, or they will never happen. And unfortunately, what's important about that, about understanding that, is that then it puts those children at a rate of 4 times more likely to develop substance use disorders themselves. So definitely something that is essential for us to understand. And when we're treating the patient, we're putting in using different approaches, to be able to address the different parts of that system of that within that family for that patient. So, for example, when it's children, sometimes being able to talk about family therapy, being able to get the family, the loved ones involved in a different type of therapy so that they understand what is substance use disorder, how do they manage it in a way that it is more conducive. So family as a system, again, family is more than a collection of individuals. What's really interesting within a family is that the members definitely function within the system very differently as if they were completely on their own, right? And so, and it's something that is sometimes not very present. Like if you were to ask, how do you act with your family? I think most of us will not even know unless we start observing what are some of the behaviors and patterns that we follow. Sometimes they're so ingrained that we've been around those types of behaviors for so long within our families that we think they're just normal. It isn't until we go visit other families, right? When we're kids, sometimes we visit our friends' families, we start to realize that things might be a little bit different within another family. So that's why it makes it so difficult for us to see that sometimes it is very dysfunctional. These patterns definitely repeat across generations. So again, if we address, if we stop, if we break the cycles in terms of unhealthy coping mechanisms and strategies, then we're breaking that cycle and putting in healthy ones, right? So it's not just stopping it, but teaching what might be healthy ones so that gets passed on to the next generations. And it's not just because of the presence of the substance use kind of puts a curtain over like what is it that we're doing. It's not just that, but it's also the models that have been being passed on. I don't know if hopefully that makes sense. And individual symptoms frequently have meaning within the family interactions, interaction patterns or worldview, right? So we might have somebody who is unable to manage their severe depression, maybe traumatic events, and it could be because of messages or ways that the family has dealt in the past, right? Perhaps in our family, we just don't, what is that? We don't air or dirty laundry out in public, right? So this is something that we just keep, and we keep passing that message on. And so we really don't look for help when we really should be looking for help, right? Here are some other great examples of that, right? We might think that we need to fix it ourselves, right? So we definitely treat the system, not the individual, because substance use may reflect other family difficulties that we were not aware, and that the patient was not aware. Substance use disorders may be maintained or exacerbated by family interactions. Very often patients will share that, for example, in Hispanic families, very often gatherings, right? Family gatherings, if somebody is sharing about not using alcohol, especially a male, we see more of an encouragement to use, right? Rather than supporting, even though we know somebody's in recovery. So even the understanding of what recovery might be very different within a family system. And then, of course, we have the whole other cultural aspects, not just the family culture, but the ethnic, the racial, a host of others, right, that we should consider. Individuals with substance use disorder often seek treatment because their family probably threatened that if they did not look for treatment, they were going to kick them out of the family system, right? And so helping the family understand. Many of us here, I'm sure we have had families that want to get involved without a good understanding of how to get involved. And it's almost like the family's understanding is us as providers, as peers, as nurses, our job is to fix the patient, right? Without their understanding that we all work within this system, including them, the families, right? And sometimes families sabotage, as I mentioned, the identified patient's treatment, and sobriety can result in a significant family system change. And for women with substance abuse issues, family interventions are highly recommended. Let's see. So barriers definitely decline, right? When we want to involve the families, very often when clients are coming here, one of the interesting experiential observations that I can share with you is they feel they've done so many wrongs. This is the time for them to just be serious and only be working on their recovery. And even when we talk about self-care, even when we talk about self-care activities, very often patients feel like that they do not deserve any of it, and that their families might not understand because they've done so much harm, right? So even in thinking of their own care, patients are already putting those barriers, let alone in wanting to share with their families how they could help. They feel like they've been enough of a burden. The family itself can have barriers because very often families feel guilty, right? In STAR, very often we hear how parents feel like, who did it, right? Was it mom? Was it dad? Who was the bad parent? Who's the one that let them do too many things, or what's too controlling? And so it starts to become almost like a blame game, and sometimes a very, very big shaming game, right? And so families feel that if they get involved, very often they feel like they are going to be judged by the treatment places, right? So a great opportunity for us to educate. How do things work? Why do we do what we do? Including, like, for example, why do we do UAs? It's not to punish, it's to keep people alive, to tailor our treatment, et cetera, et cetera. And so that way they understand that this is not about finding out whose fault is it within the family. Staff barriers, sometimes it's difficult for us to try to figure out how do we deal with families. Sometimes we might have some patients who present with very complex issues. And so nothing like trying to imagine this idea of not only do we have the patient with complex issues, but now we're bringing in the family. How do we do that? How do we care for things? And so that's why it's very important to get to the next one, have systems where we're talking about this, like today, how important it is to put in place educational programs. How do we put systems? How do we have a program within our clinics that allows families to be able to be part of the treatment? Some treatment centers do not allow family involvement, which can be very perilous. So remember, sometimes even just engaging one family member can make that difference, or a concerned significant other. Again, it doesn't have to be a blood relative, but definitely involving one more person. We have patients that talk about accountability, that talk about feeling supported. I mean, that's a great place for us to be able to collaborate with our patients, to be able to find out how is this family member, not only how are they involved, but then how might they help, right, in terms of their treatment. Here's a really nice list, right? Family members can be involved in learning about the treatment program, recovery processes. Sometimes we bring family members to understand what trauma is, so that they understand how trauma is connected to the substance use disorder, so they understand how to support them in the treatment for trauma that consequently can help reduce substance use and increase recovery, meeting goals. So they can even participate in the intake process. Again, all of this is with the patient's permission, always. Attending family groups, appointments, encouraging and supporting the family member who's in treatment in a gentle, not in a nagging, gentle, non-judgmental manner. These are great books to have. The first one is Robert Myers, who developed CRAFT, Community Reinforcement and Treatment, Family Treatment. I'm sorry. And then here's another one, which is Beyond Addiction. There's another one it's also from Robert Myers, that talks about, again, how do we get our loved one into treatment without nagging? I think what a great way to put it, right? So why is that? Because not only is it's a good thing, patients tell us that once some of those barriers are taken down in terms of their understanding of family involvement, the family's understanding of no blaming, no shame. Not only do we know that patients feel more supported, but also research shows that they can show great increased rates, not only for recovery, but also for retention during the treatment, which increases recovery chances. Notice that here's a list. So a CRAFT is this one right here, the motivating substance abuses to enter treatment. But there are other approaches that can be used, including Matrix. IOP, for example, has portions in which the family comes in and they have education classes about substance use disorders, even substances, about different types of information that can be good for them. And then also sometimes they'll have groups where they can come in and share some tools. Notice multi-systemic, again, family therapy would be another one, and then brief strategic family therapy. For example, here we use very often CRAFT, in particularly with families of adolescents, but we also use it with adults. And we've had not only parents, we've actually had friends of those who are being treated for substance use. Okay, I think I'm going to say, so ways to encourage family involvement. We can provide referrals, right? So we can inform the patient what are some of the options that your clinics might have. If you don't have a program, you can talk to other programs to see what might be something that would be a good match for your clinic. You can have even psychoeducation groups, maybe family orientation, even like something like Narcan training, right? How to keep someone safe. Rona provide a list of support groups. So if you don't have something at your clinic, being able to refer out. And then even things like showing the family what does the treatment look like, the facility itself, right? And then they can come in to appointments. Like I mentioned, in our area in the therapy side, very often we invite family members to at least come and talk and just hear what it is that we're doing. They don't have to be involved in the specific treatment. Just very informal, an informal way for them to see what is happening. Again, they can have a way to contact your clinic, but make sure that you're following your clinic's rules and guidelines in terms of how did they do that, like having release of information in place, anything that protects the patient. We just want to make sure that it isn't where we're actually it is actually becoming something that is harming the patient that instead of helping them. And then you can do even parts of contingency programs where you have the whole family involved in incentive programs for attendance and participation. Here's some other options. Oops. Let's see. Yeah, here are some other options listed for you in terms of what else. And then one thing to be able to remember is the approach, right? So you can coordinate with, if you're a physician, you can coordinate with your therapy team. If you're a therapist, you can coordinate with other teams to be able to see how can you support family involvement and to what extent. And then four major things to remember in terms of family involvement, that the family can be very helpful from a bigger picture, right? Health, home, the home environment, purpose, and community. So if as a patient is working in recovery, or their healthy lifestyles are very essential, and nothing like having a whole family working towards that, not just the one person within the home environment, within the family system, and then home being a place where our patient feels like they can go back and feel safe. Even like I mentioned, even if it is a treatment for something that has taken them to use. So for example, even if it is having a safe environment for when they're getting PTSD treatment, as they're trying to achieve the overall goal to reduce substance use, right? Purpose, which is another one. I think often we work within our sessions talking about values and what is important for patients. What is it that motivates them to change the big goals in life? It is so much easier when the family is involved, because then we talk about the connections, right? Those connections with their kids, with their spouses, with other family members that make it more meaningful than what we do only on a one-on-one, right? With our patients. And then of course, community. What is community out there once somebody is in recovery, where you're trying to find who is available, what is available within the community without substances, right? Communities where the reduction in risk is because there's no availability of substances, but instead of that, or very reduced availability of substances, but instead of all these other options to be able for them to engage in healthy skills usage. And so think of that big picture, how family can get involved for that patient. So again, there's several therapies mentioned there. I know this is the last slide. I strongly encourage you, if you are at a place where you don't have family involvement, you can try to see how you can partner up with other organizations in your community to see how you can work together so that you're supporting the patient from the family perspective. Let's see, I see. Okay, so I just saw a couple of texts. I think so I'll stop there. Stop my share. Questions that you might have